The majority of everyone here has probably watched a loved one suffer through cancer. Cancer is a mutation of the cells that plagues many Americans every day. Some go through treatments and surgeries. But did you know that the radiation and the medicine given to patients experience many side effects, such as severe pain and weakened muscles? In order to improve the state of the patients, they must go through rehabilitation services. This type of therapy is called occupational therapy. Specifically, I'm going to be talking about how impactful occupational therapy is to cancer patients. Occupational therapists can be found in hospitals, schools, rehabilitation facilities, and private practice offices. Recently, there have been an increasing number of occupational therapists working with cancer patients. Today, I'm going to be informing you on practicing occupational therapy with cancer patients, explaining how it is a very effective therapy. You will learn about the ways occupational therapists are dedicated, and hopefully use this information to better help you or a loved one if you are ever faced with this disease. Occupational therapists act to improve cancer victims' daily lives. They disregard the fatality of the client and focus on improving their independence. They can work with patients who are newly diagnosed, undergoing treatment, or even in remission. Whichever stage they are going through, it is the therapist's job to address the limits and develop methods to overcome or adapt so they can live as close as they can to an average functioning life. Cancer causes many setbacks in one's life, and in order to achieve functioning, they must go through therapy and interventions that occupational therapists provide. There is a quote by Sheila Longpre of the American Association of Occupational Therapy, where she explains that due to the uniqueness and complexity of human occupation, each individual diagnosed with cancer will experience different limitations in his or her various occupations, roles, and restrictions. Ultimately, they want to make patients feel as close to themselves as possible so they can forget the disease they're suffering through. It is important for patients to feel as close to themselves as they can. To help this even more, they need to be treated for their pain. People with cancer experience a lot of pain and are not used to the suffering. So occupational therapists work to reduce pain and help them adapt to being weaker. They use functional therapy to address pain, therapeutic exercises to improve joint movement, and strengthen muscles. This prevents pain by stopping physical deconditioning, which is caused by a lack of physical activity. Occupational therapists use prevention interventions in order to stop pain from worsening. With an early referral, they can reduce chronic pain and overall exhaustion. Now that you know how occupational therapists work to reduce pain, let's talk about how dedicated they are. Every action is centered on the patients for their benefit. Each client has their own unique set of disabilities, so they will have to address them each time. They take in the personality, physical, and mental limits of the patient and use these to plan activities and assessments to teach daily living skills or how to adapt to their new lifestyles. They use psychological strategies to improve their mental state and overall well-being. They conduct experiments and research to ensure their recovery. They have to order equipment, travel, research, work in close contact with the patient's other doctors and therapists, and even teach their family members how to assist their patient. Overall, each patient is the focal point of their work. After learning about roles and benefits of an occupational therapist, let me wrap everything up. Cancer is a disease constantly plaguing people all over the country with limited cures and treatments. The use of occupational therapy is becoming more widely practiced, so that there could be an enhanced state of cancer patients. This disease affects families every day, and everyday lives are lost. Anything that can be done to lessen the pain and improve the well-being should be taken to action immediately. Thank you.